Today's video diary from the World Health Summit 2010 is brought to you by the Faculty of Medicine, Nursing and Health Sciences at Monash University.
Hello and welcome to day 2 of the World Health Summit, coming to you from the Charité campus in Berlin. It's been a very interesting day here at the Charité, and joining me today is Professor Wendy Cross, who is the head of the School of Nursing and Midwifery at Monash University. One of the sessions we both sat through this morning, Wendy, was the Universality of Health Econometrics. That was presented by the German government and Imperial College London. The session focused on the transformation of health economic evidence into practice and the concept of a universal measurement for the cost of healthcare on the basis of a specific patient. A lot of Australian data actually presented at that session, I noticed, obviously because of restrictions on the use of European data. Wendy, what are your thoughts on that session?
Clint, that was a really interesting session, and they presented some excellent modelling with regard to medical treatments around certain disease processes and certain conditions. However, there are a lot of aspects to the costing of health that weren't necessarily presented in terms of the cost, for example, of stroke care for non-medical treatments such as physiotherapy, occupational therapy, or the cost of specialised stroke units. So I would think that whilst the modelling was excellent, there is still some work to do, given that the cost of health and the cost of health care provision isn't just about medical treatments, it's about the whole basket, and they call it the health basket, and which was a very interesting concept in its own right.
Mm-hmm. And also the other session we sat through was mobile health, telematics in medicine. Now this was the future of cyber education for health professionals, and particularly the need for those professionals to remain current in their qualifications. Real emphasis on training physicians in an evolutionary manner, and this obviously applies to allied health professionals as much as it does to physicians. A lot of talk on having an evolutionary process that mirrors the advancement of technology as well. Now you've done a lot of work in simulation within our nursing school. What were your thoughts on that session?
Well, I think that the session itself was very useful, and I think the big message coming out of it is the importance of embedding e-health or e-learning, I should say, in curricula in some way, because the importance is that people are able to have up-to-the-minute information, that they can access that information in their own time and when they're ready, that they can then utilise that in their workplace on a day-to-day basis, and they can have access to it readily wherever they are worldwide. And it seems that the information is now being provided, not just locally but globally, and so I think the big message from that is about the flexibility of curricula to enable that to happen, whether it's in preparation for practicing pre-service courses or as ongoing learning and upskilling, and as a large proportion of the sessions were maintaining credential.
A really interesting session, that one, with the connection of telerobotics and the Canadian experience from their space program as well.
Yes, I think that not only is the mechanism for transmitting the information becoming much more sophisticated, the mechanisms for actually doing the work are so much more sophisticated in terms of surgical procedures through robots, and one could argue that in time it might be that surgeons themselves might be out of a job, that other people may in fact be able to manage these, technicians and various other things. So I think that there's a huge conversation to be had in the future with regard to those sorts of technological advances.
Now, another big session that's on at the moment is in regard to climate change. Particularly, climate change could damage your health. And this relates to some of the work that Margaret Alston has done at Monash University. It's a study of the connection between climate change and the effects of drought, air pollution, rodent-borne diseases and so forth. So that's happening now. And I can tell you tonight, one of the real highlights of the social program is the performance by the World Doctors Orchestra. This is around 70 physicians from around the world, and what's happened is they've put away the white coats and pulled out the musical instruments. Tonight at the Concert House in the Gendarmenmarkt here in Berlin, they will actually perform Beethoven's Ninth Symphony at a charity concert, and it's pretty special because the Concert House is where Beethoven's Ninth Symphony was actually performed for the first time, Wendy. So you and I are going to enjoy that performance this evening. Apart from that, it's been a very big day here in Berlin. We'll be back with another video podcast for you tomorrow. Until then, keep in touch with us via the World Health Summit website, which is worldhealthsummit.org, or through the Monash website, which is med.monash.edu, and you can follow us 24 hours a day and have dialogue with us through Twitter. That's Monash_FMNHS. Until tomorrow, from here on the back porch of the Langenbeck Virkhoff House, it's goodbye from Berlin.